5 minutes.
I would just start by saying that actually Mark Cuban retweeted this idea already, so I feel like we've already won. I'm here to talk about the CMS AI Health Outcomes Challenge. It is a $1.65 million innovation challenge, a prize competition designed to encourage innovators to use CMS data to predict health outcomes with AI-driven methods like machine learning or deep learning and neural networks. We really want to accelerate development of real-world applications for the technology in clinical settings. From the problem side, I'm sorry, really quickly before I say, we don't have slides obviously. If you go to ai.cms.gov, you can see everything I'm talking about. So it's ai.cms.gov. We were looking at how we could sort of incentivize innovators to get involved with their data, sort of free the data, change the incentives. And we looked at the high rates of unplanned admissions to hospitals or skilled nursing facilities, and the high rate of adverse events that are unplanned that occur with the Medicare beneficiary population. And we wanted to, number one, use AI and deep learning methodologies to predict those unplanned admissions, and also to develop innovative strategies to actually explain the AI-driven predictions to frontline clinical staff. That's a really important element of this. There are plenty of people out there already working on various algorithms to predict outcomes, but not necessarily to build solutions that actually help people understand how to implement them in clinical care and actually trust those solutions and trust those predictions. That's a really important element. So we're looking for solutions that are accurate and actionable and explainable and trustworthy. We're planning on having this run for about a year. The launch phase actually already started on March 26th, and it closes on June 18th. So the public, hopefully diverse teams of clinicians and data scientists or technologists and researchers, and hopefully also patients, will get involved and form teams to actually solve this problem in a really cross-functional way and a diverse sort of way. As I mentioned, there's a $1 million grand prize. There's a $250,000 runner-up prize, and we have some prizes sort of for the intermediate stages to keep people working and through the different stages of the competition. So that's pretty much the basic idea. To actually apply, you need to fill out an online application and talking about how you would potentially solve this problem, give us an idea of sort of what you're intending to do, and you actually don't have to access our data until the later stages of the competition. For this challenge, we know that CMS data as it stands is not ideal. We know that there are lots of other data sources that are really relevant, but we thought we should launch and start this to see if we can sort of put some pressure on the system and see if we can figure out a better way to provide data for innovators. We know that data, high quality, connected data is really, really important for AI application in healthcare, and so we really wanted to make sure that we could at least get people talking about it and tell us what we need to do to make it more accessible for AI applications. So that's the challenge. Again, it's at ai.cms.gov. It's a place for us to start. It's the first time CMS has used this type of authority to run an innovation challenge, a prize competition. And so we're really excited to see where this takes us, and also if we can sort of launch other innovation challenges after this. That's it.
All right, thank you. All right, Sharks, now's your chance. 5 minutes. Who wants to go first?
So you said bad data, and I'm sitting here to this table with these two doctors, so I can't read a word they're writing over here. So how's your system going to deal with bad data from doctors and providers?
I don't know if it's necessarily bad data from doctors and providers, but certainly any algorithm has to be able to account for gaps in data. We're talking about a very structured and labeled data source. So administrative claims data is very structured and labeled. People will have to make adjustments in their algorithms for things like over-coding, for example, but that's something that is kind of known already. So that's what we're asking innovators to do with the challenge.
So can you, if you were a nurse, you could read our writing, so it's your fault. So to give you an example of what a successful outcome of this would be, using an example of the type of data you have and how you'd implement the solution.
Yeah, so ideally we would have a winning team or winning participants who create a highly predictive algorithm. So it gives an output that says with a high, the actual technical term is the area under the receiver operating characteristic curve. If you're not a data scientist, ignore that. That says sort of what is the certainty of your prediction that you're making And then you would also say, in addition to that, not just the number, but also here is a visual, a type of solution that a clinician can actually take with them as they do their work.
I mean a real example, not that hypothetical.
What type of?
Oh, you're talking about readmission or an adverse event? So
Absolutely. I'd be able to say, for example, the people in my population, the people in my panel have a risk of admission to a SNF or that's a skilled nursing facility or a hospital, and therefore I should take action now so they don't go into the hospital. That's the outcome we're looking for.
So
Predicting health outcomes so that you don't actually get sick, so that you don't actually go to the hospital.
This is a very solution-focused challenge, and CMS should be commended for pushing new solutions, but I'm not sure if the problems are really defined. Like what, if someone has a better solution that isn't like AI per se, would you fund that? It could outperform an AI solution.
10-second answer.
Yeah, absolutely. I think that we're looking for solutions that incorporate AI, but it's not necessary to solve this problem. In some cases, we